Greetings. Welcome to the Brain Gauge channel. I'm Mark Tomerdahl, and on this little video, we're going to talk about how does testing with the brain gauge compare to sensory testing. This is an important question, and basically the reason it's important is because many people think that because you're testing that the brain gauge is vibrating the fingers, they think, oh, you're just testing the fingers and the ability of the fingers to feel things. And, one thing a lot of people think is, number one, they think, oh, well, it's just what's going on in your fingers has nothing to do with in your brain. And that's really not true. Obviously, you don't perceive anything unless it's in the brain. And so this is kind of an important question from that perspective. Another perspective is that for about 50, 60 years before we started working and promoting or developing our methods, uh, most researchers were very heavily into looking at thresholds, and it's basically things that were really strongly influenced by skin sensitivity, and that really doesn't tell you a whole lot about what's going on in the brain. Our measures, we try to focus on what happens in the brain. So traditional sensory testing, like it or not, and probably offend a few old time people, but might have probably outlived most of them. Basically, the old traditional methods really were influenced by skin sensitivity way too much. Now let's talk about it a little bit more and go into a little more detail. And next slide shows that traditional sensory testing targets thresholds. So what is a threshold? Threshold is the minimum stimulus you can feel. And what does that mean? Well, the way it can be measured, and still is a lot, is you take what's called a calibrated von Frey hair. And these are literally, they're like hairs that have a specific strength or force to them. And when you apply them and you basically you just press the skin and ask the person, hey, can you feel that? Okay, so first problem here is it's got to be administered. You got to have a person actually doing this, and it's tough to get good help. So that's really not and these calibrated von Frey hairs, what you do is you start off with maybe a stiff one and you can get stiff ones that are really, they don't bend at all. They're like a small nail, and all the way down to really light, delicate hairs. And you just use different ones. So and go down and down and down. But until you find something where the person says no, they can't feel it anymore, then you know what their threshold is. Now, if what's going on when you deliver this kind of stimulus? Well, you're basically this line here is zero. There's no stimulus. Then you push whatever you've got in, and then you pull it back out. So you push this into the skin and then back out, and that's your stimulus. However, what's going on in the brain? Like I said, we're interested in what goes on in the brain. So if you look in the brain, if you actually stick an electrode in the brain, you'll see some activity, and then you'll see a little more activity when that's pressed into the skin, and then it'll go back down to just chattering. That's labeled as noise, but quite frankly, what's going on in the brain that's chattering, and there's all kinds of activity going on in the brain all the time, but it's really not noise. It's really important activity that's going on, and the perception, even though call it noise or whatever, but perception, in the terms of perception, it is noise, because you don't perceive that stimulus until this signal is larger than this baseline activity. And so what you want to think about it in terms of is signal to noise ratio. So you have a signal and then you have noise. So that signal to noise ratio is what's important. Where perception happens is where the signal is stronger than the baseline activity or stronger than the noise. Signal to noise ratio is a very standard engineering practice for developing all kinds of tools. But it's important to have a good, clean signal, both in the brain or in whatever you're designing. But you basically, the thing that you want to think about here is, okay, how could we design a test that would actually work a little better than that? How could we get big signals and look at that? And so anyway, what the brain gauge does, it maximizes signal noise ratio. And I'll discuss that in a minute. Okay, so first we'll just talk about how do we get threshold tests. And for now, let's just not even discuss dynamic threshold. We're just going to talk about static threshold. Static threshold, the way we test and what's the minimum stimulus you can feel is first we say, okay, this is a stimulus we're going to deliver, a gentle mechanical vibration. And this is about, it'll start, say, at 20 microns, which isn't very big, but on one finger, there will be nothing. On the other finger, there'll be a stimulus, a vibrating stimulus. And then a question will pop up on the screen for the person taking the test. And the question will be, which of these two stimuli is larger? One of them's on one finger, one's on the other. And obviously, the right answer is going to be this stimulus. Now, each time you get it right, this gets smaller. Just like reading an eye chart. Starts out easy, gets smaller and smaller and smaller until you just can't do it anymore. And, for people in this age group, that was around 5 microns. For people over 60, it runs up to about 14, 15 microns. So that's the minimum stimulus people can feel at that task. And, keep in mind that this was all done automatically. It did not have to require somebody to deliver that assessment, which is sort of a traditional sensory test where they use a von Freyr, like I mentioned before. Dynamic test is a little different. It still is asking you the question, which is larger, but it's a little different in that it delivers a subthreshold stimulus, and it increases the size of that stimulus until you can feel it. And when you can feel it, then you respond. And you typically respond at a point that's greater than what your static threshold was. So and the reason we do that is, again, we're only interested in what goes on in the brain. And that's really the topic of a whole nother video, and it's called feed-forward inhibition. But basically, which I haven't made yet, but it'll be out soon. But basically, what you're looking at is a difference between the static and dynamic threshold. But that's not the point of this lecture. We're trying to say, what is the difference between traditional sensory threshold testing or traditional sensory testing and what we do? And of course, we're trying to look at mechanisms of information processing. Well, that's one way to look at it. So I mentioned signal noise ratio, and this really, we're still doing static threshold. This is not a good signal to noise ratio thing. It's hard to do because it's still down in what we call noise or baseline neural activity in the brain. What happens is, let's take a typical test that we do with the brain gauge, and that is amplitude discrimination. And this is what provides data for the accuracy score. And so we're just going to look at amplitude discrimination and just focus on this part. Amplitude discrimination, now we're delivering one stimulus versus another. One of them is not zero, so you're not trying to track it down to that minimum stimulus where it's just barely above zero. What we are doing is the minimum stimulus we're delivering is 200. That would be the smaller stimulus, and the larger stimulus starts out at 400. Those are way above threshold, way, way, way above. It's called super threshold stimuli. And what we're interested in is how these stimuli interact in the brain, how delivery of this stimulus through the fingers, where it projects into the brain and activates places in the brain, how is that activated? Okay, so what we've set up here is that we've got super threshold stimuli, and because we don't see any changes with age, just like with amplitude discrimination, with the super threshold stimuli, we say, okay, that must be a central metric. And then that's a centrally mediated metric or cortical metric. But the sensory threshold, the static threshold, was not, it was really greatly influenced by the periphery. And, that's sort of, most people take that on faith, but, some people say, well, you haven't really proved that. Well, how do you prove it? One way to do that is by changing something in the periphery, which does not impact the centrally mediated measures. So what we did a study where we said, okay, let's look at peripheral versus central metrics. And what we did was we had people put their hands in cold water and ice water, numb their hands until their thresholds got worse. And so here the thresholds went from like 5 to 7. That's a pretty significant change. That's what this means. It's a significant difference in the threshold. It got much worse. However, not so bad that they're completely numb, but it had no change at all on the cortical metrics. So reaction time doesn't change. Reaction time variability doesn't change. And we did this in multiple studies. So we published one of them. Temporal order judgment does not change. Duration discrimination does not change. And most significantly, amplitude discrimination does not change. So even though their hands were cold and a little bit numb, and I've seen some other studies where they actually repeated this, but got their hands even more numb than they did in this study, and they still didn't see any changes with with these cold immersion. So anyway, that sort of pointed out that yes, these metrics are centrally mediated, and things like peripheral neuropathy, yeah, they will contribute to it, but your threshold does get worse with cold. But it does show that while one measure may change 30-40%, the other measures didn't change any. So anyway, if you have questions, please send them to me, and I'll be happy to make a quick video or either if I can answer it, I'll answer it. If I can't, I'll just make up an answer. Anyway, let's have a great day, and thanks for watching the Brain Aid channel.